Hello, good afternoon, everyone. I want to say thank you all for joining us for this town hall, which will be our introduction to Cigna. Um, I will go ahead and share my screen now. Perfect. And so, hello, my name is Jaron Lowe. I am the Interim Vice Chancellor for Human Resources, and I will be your host today as we walk through this medical provider change and introduction to Cigna, our new provider. On this town hall, we have 5 panelists, Hillary Baca from Cigna, Tiffany Vermillion from Gallagher, Michelle Moreau from Gallagher, Brandon Canfield from Cigna, and Courtney Lake from Cigna as well. We are really going to be pressed for time, and we want to make sure that you have the opportunity to hear everything that Cigna has to share and open it up where we can get some engagement from the community around any questions and thoughts to share with all of us moving forward. So next slide. So the question of the healthcare provider decision, I'm here to share with you the why and the why now. So as you all, many of you are aware, we in 2020, at the end of the fall into the winter quarter of last year, we conducted a survey of our employees, a benefit satisfaction survey that we rolled out twice. We had about 53% participation rate around that. Prior to the 2020 benefit satisfaction survey, we also conducted an employee engagement survey in May of 2018, which also requested information about benefit satisfaction for our community. And so with that, the feedback that we received shared, some concerns, some requests for expanded benefits, expanded value that our current provider at the time, Kaiser, was not providing for our community. So with that, we decided that we needed to do a request for proposal, which was advised by our vendor, Gallagher, considering we were up for renewal and we hadn't had this request for proposal in quite some time with Gallagher. So in February of 2020, or in February, we got the results from the providers. Those were given to Gallagher, who reviewed the providers, and there were 5 at the time, in which that got dwindled down to 3. And in middle of March, the providers shared their bids and proposals to our RFP committee. And then we found ourselves in beginning of April and up to this point where we've made the vendor selection and communicated that to our community. And so now we are at the point of sharing more information with the community moving forward. So why do we do an RFP process? Well, as we have a fiduciary duty to exercise due diligence and test the market and really make sure that we are providing the best possible coverage to our community. Like I said, with the outreach around the benefit satisfaction survey and the employee engagement survey, we were now provided rich information about what our community was demanding and expecting of their healthcare provider. And with that knowledge, we had to go forth with due diligence and look at, are we improving the options around choice? Are we addressing equity concerns? And are we also looking at lower costs for our community as well? Like I said, there were 3 providers that shared or presented to the RFP committee, which was Kaiser Permanente, Anthem, and Cigna. Cigna and Kaiser came out of that review as the most competitive bids. So what made them the most competitive and what were we looking at for our decision-making factors? Network viability, mental health support was huge. We received a lot of feedback around wanting more access to mental health, being able to get immediate appointments, and also culturally competent or culturally focused care in the mental health space. There was a lot of response around infertility benefits and more expansive coverage in that space as well. Um, and then there were also decision-making factors around our performance and financial guarantees, the risk share arrangements, greater choice for lower costs, and absolutely we had to focus our energy and care around the membership transition services. And that's where we are right now, sharing what does this transition and implementation look like in the most seamless manner for our community. So why now? Well, as I mentioned, we were coming up on renewal and we had conducted the benefit satisfaction survey. So in order to exercise due diligence, we needed to go to market and do this RFP process. Surprisingly, we received such a competitive result from Cigna that we absolutely had to entertain, you know, this option to provide for our community. The other piece was that when we go to market, we have to submit our most recent claim information to the bidders or the providers so that they can accurately put together a bid to share with us. So the question has come around, well, what if we delayed the decision here? One of the major problems with that is that we have no guarantee on a future rate or bid. Like I said, this competitive result that not only expanded benefits, quality of care, access, equity, and low cost, we absolutely needed to act on that opportunity. And then we also have the ability to align our long-term disability and our life insurance offerings with the same carrier within Cigna, and making those more seamless provider and support benefits moving forward. So the question has come up when we went through this review about why not a dual option? Why not provide Kaiser and Cigna and allow for more of a staggered opportunity for transition as opposed to one sole provider and a transition effective 7/1. Well, the reasons are before you. Both providers were stating and proposing an increase in costs and higher prices that would result on the employee. There was no second year price cap as well. And then this also removed the risk share agreement, and we would lose the existing point of service option that many of our folks or percentage of our folks utilize with the Kaiser option. If we went to dual, that point of service option would go away. So now to pivot, this healthcare provider decision, what were the benefits to the employees? So you hear us mentioning that. So let me show you what kind of a comparison of what we previously had and what we are going to be entering into. So looking at our metro area hospitals, as you see, with the Signal local area PPO, there are 39 metro area hospitals. So this expands the number of access to hospitals that we currently had. And then there are also 21 additional other Colorado hospitals that we're able to access with the Cigna plan. The primary care provider piece and the structure that Kaiser has, one with Cigna, and this will be discussed further around the primary care providers, but this network has expanded to over 4,000 network area providers. In addition, 14,000 plus specialists. So you can see this is vast. In addition, as I mentioned, the mental health providers, you see this, a staggering 7,100 plus mental health providers in our local area under Cigna, as opposed to 250. This is key, as we had many folks explaining that it's taken weeks to be able to get an appointment with their mental health provider, unless it's an emergent situation. And then I also want to call out that in Cigna's overall coverage nationwide, there's over 200,000 mental health providers. However, 18,000 of those specialists nationwide specialize in culturally competent care. So knowing coming out of the pandemics with the social unrest, civil unrest, this is a huge request of our community that we wanted to meet from an equity space. Cigna being national also provides national coverage. And then as I mentioned with infertility, intrauterine insemination is an unlimited benefit and service under the Cigna plan, as opposed to 3 lifetime benefits with Kaiser. So I want to also share quickly around the savings and lower costs. So by moving and transitioning to Cigna, we're able to eliminate the wellness incentive that was tied to our premium costs that we had previously with Kaiser. So 46% of our DU employees will see anywhere from 22 to 33% in total savings this year. Not everyone utilized the incentive program, we know that, but they will also see an average savings of 13% this year. And with this transition, the annual cost was reduced by $1.2 million. And these savings we return to you all, to the employees, to the community. With that, we're also able to provide a 1-month premium holiday to where we are not paying for that premium in a particular month, which we've identified as November. And then I also want to say, for those of you who may have had accumulation of deductibles or other out-of-pocket expenses from January to June, those will be credited. And then lastly, in addition, the WellMetrics Premium Incentive Program will end, which I mentioned in the beginning of this slide. So with that, without further ado, let me go ahead and transition over to Cigna to share their introduction and benefits.
Great, thank you so much, Jaron. Just gonna make sure everyone can see my screen here. Great. Okay. So today I am going to go over just a basic introduction to Cigna. I'm going to tell you a little bit about some of the programs that we offer, some resources that are available to you. And the first thing I want to say is really that we're so happy to get the opportunity to work with all of you at DU. And we recognize that this is a big transition. And we're here to help you through that process and make this as easy as possible. We know you're going to have a lot of questions as we walk through this information on this transition. So definitely plan to attend all of these town hall meetings that are coming up, document the questions that you have as we're talking about these things, and definitely communicate with us. We have resources available to answer those questions. So today I am going to be going over who is Cigna. We'll tell you a little bit about us, what your access to care will look like. So Jaron touched on that a little bit, so I'm going to go a little bit deeper into that access to care piece. The programs and resources that you will have access to, so some of those different things that will be available to you, such as behavioral resources, resources for chronic conditions, lifestyle management, and so on and so forth. Options for virtual care. This has become really a big deal over the past year, having additional options for care virtually. We'll go over an overview of transition of care, and we'll let you know where to go as you have questions, both before the July 1st transition and after we transition the plans on July 1st. And then just a reminder, we will take all of your questions at the end of this presentation. So after I'm done presenting, we will then open it up and start answering as many as we possibly can. Okay. So first of all, who is Cigna? We are a global health services company, and really our primary mission is to improve your health, well-being, and peace of mind. Some of you may have worked with us through another employer before. Some of you may have been on a spouse's plan that had Cigna. And to the rest of you, we're a new partner for you. So definitely we're excited to partner with you and give you some more information about us. We have a large national footprint, so we have a nationwide network for you to access care whenever and wherever you need it. You can choose a provider from thousands of different doctors in our network, both locally and nationally. So this is, as you could see by the numbers that Jaron shared earlier, this is a vast network with a vast number of providers that you will now have access to. It's far more than double the size of your current network. Seeing a PCP is not a requirement within our network, so you are more than welcome if your first visit after July 1st, if you need that to be to your OBGYN or maybe your dermatologist, you're welcome to go and see that specialist within the Cigna network without seeing a PCP first or without establishing that relationship first, even though we always recommend it. And then most major hospitals in the area are within our network as well. So you have, what you are moving to is a vast amount of choice when it comes to your care, whether that be your PCPs, your specialists that you work with, different options for care such as virtual care, and then hospital emergency care as well. And then we wanted to show you this picture. We're actually neighbors of yours right down the road at Colorado Center on Colorado and I-25. We have a large number of employees here in the Denver market. So again, we welcome you and we're excited to work with you. So a little bit about our Local Plus Colorado network. This is the network that Jaron shared information about here in Colorado. So I wanted to give you some perspective on how vast this network is and what your access will look like. So you are going to have access to over 4,000 primary care providers under this network and over 14,000 specialists. And keep in mind, as I mentioned before, a PCP is not a requirement under this plan. You can see a specialist in this Local Plus network whenever you want to. But we always recommend that you have a PCP relationship. We recommend that because it's great to have a PCP to act as sort of the quarterback of your care. In addition, we have a broad national network. So our Local Plus network is all over the country. If you happen to be traveling, you happen to be in another state for vacation, or maybe you have a child away at college that is outside of the Local Plus coverage area, you can access our away from home care network that will let you see providers within our open access network for Cigna. So really the point I want to get across here is that you do have nationwide coverage for care regardless of where you're at, so you can feel comfort in that. We also work with 60 hospitals in Colorado. So again, as you saw on a previous slide, 9 of those are local, and then the remainder are, outside of the Denver metro area. But some examples of hospitals that we work with locally, which should be familiar to you, are UC Health, Children's Hospital, Centura Health, National Jewish Health, SCL Health, and Health One. A lot of healths there. So a lot of options for care, and you have access certainly to those larger health systems when you need them. In addition, I definitely want to touch on the fact that because our network is so vast and you have so much choice available to you, you're not going to have issues finding providers, that are taking new patients. So you'll have lots of options, and as I'll touch on a little bit later in this conversation, you can go onto Cigna.com at any time to look to see what providers are in network and taking new patients, and kind of start taking a list of providers you might want to contact to be your PCP or specialist. Okay. In terms of pharmacies, we also have a vast network available. So you have options when it comes to refilling your prescriptions, whether that's at retail or home delivery. So we have thousands of retail pharmacies within our network. Some examples of that are, your smaller local pharmacies, grocery stores such as King Soopers or Safeway, retail chains such as Walgreens, Walmart, CVS, and then wholesale warehouse stores. So that's like a Costco. So those are just some examples, but the network for pharmacies is vast, so you will have many, many options available to you to fill prescriptions. In addition to those retail pharmacies, you also have the option to fill prescriptions at our home delivery pharmacy. So you'll have access to this through mycigna.com or by giving us a call. and you will be able to get free delivery on any medications for up to a 90-day supply. So this makes it so you don't have to go to that retail pharmacy every 30 days. We'll send you reminders so you know it's time for a refill. You have access to our licensed pharmacist 24 hours a day. We offer payment assist options if you need help paying for your prescriptions. And you can manage your medications at any time through our mycigna.com or MyCigna app tool. And as I mentioned earlier, at any time you can hop onto Cigna.com right now before the plan starts to search for pharmacy within the Local Plus network. And I'll show you some screenshots of how to do that during this call, and we'll definitely touch on that again during one of our future town hall meetings. Okay. So now I'm going to talk a little bit about some of the resources that will be available to you as of July 1st. So these are additional resources around behavioral health or chronic condition care. And really the idea is that these additional resources will help you manage your health and become a well-informed healthcare consumer. So first and foremost, what we one of our most important and most used tools that will be available to you as of July 1st is the mycigna.com website and the MyCigna app. So starting on July 1st, you can go onto the website, you can register, and you will have access to things such as finding care and costs. So you can search for a provider, specialist. If you need to get a surgery done, you can search for a facility to get that surgery done. And you can also estimate how much that surgery might cost based on your own plan design. You can view claim information. You can price a medication or look for a pharmacy there. We have a robust set of wellness tools available to you as well. And as you can see on the screen here, there are multiple ways to connect to care, including virtual care. So you can chat with customer service, you can chat with one of our nurses, or you can connect right to a doctor or a counselor for a medical or behavioral visit. So in addition, we have several emotional well-being capabilities under the Cigna plans. So this is something Jaron touched on earlier, right, is our access to behavioral health services. So we have several tools available, including 3 visits with an EAP provider, access to work-life support. We offer on-demand monthly seminars on topics such as children and families, autism, substance use, and eating disorders, and we can offer referrals to different community resources. In addition, we've partnered with iPrevail to offer on-demand peer coaching and personalized learning, and Happify is a digital self-guidance tool to increase resilience. In addition to those tools that I just mentioned, we also partner with several programs in the behavioral space. Some of these might be familiar to you. So Talkspace, if you've seen commercials with Michael Phelps, that's the same company, Sondermind and Maru Health. And what these will do for you is that it will allow you to access providers the same way that you would access any other provider. So you have new modality options to access these providers, such as text messaging. You'll be able to access peer-to-peer support services with these providers. You have the ability to self-manage your care through online tools. And there will be increased availability with increased additional providers in the behavioral space as well. These are super easy to schedule appointments with our online scheduling tools as well. So in addition to the behavioral space, we also have chronic condition support available to all of our members. So you can work with a trained health coach to create a plan to achieve goals around your conditions. They work with 16 different conditions, such as asthma, heart failure, type 1 and type 2 diabetes, low back pain, depression. And essentially you work with a coach to achieve and create goals around your condition, and also create a plan around complying with your medications if that's applicable. So our health coaches are well trained, and this is a great resource to access. In addition to chronic conditions, we also offer 3 lifestyle management programs. So if you need support to manage your weight, quit using tobacco, or to cope with stress, we have health coaches available to help in these areas as well. All right. So next, I want to touch on virtual care. You know, the pandemic definitely taught us how important it is to have different ways to access care. And so for a time, you know, providers weren't taking in-person appointments. And now that things are getting a bit better, some folks are still not comfortable going in person to see their provider. So we have many options available to you in the virtual care space. So that includes care management. We have a virtual diabetes prevention program with remote monitoring that you'll hear more about as we get closer to open enrollment. We offer digital case management for COVID-19 and a workplace clearance tool. We have a 24/7, 365 health information line staffed by nurses that you can reach out to anytime. And then virtual care itself is available from both network providers and vendor partners. So what I mean by that is PCPs, specialists, all kinds of providers within our network have actually adapted over this past year and are able to offer appointments virtually if that's something that you want to do. So definitely when you partner with a new provider, that's something that you can ask them. In addition, we work with Live as our primary virtual care provider, in addition to all of those other behavioral providers that I was telling you about earlier. So you can seek virtual care for primary care, minor or urgent concerns, specialty care. You can do virtual wellness screenings. And on the behavioral side, you will have access to both psychiatrists and licensed therapists, licensed counselors in our EAP network, and digital tools, of course, that I mentioned earlier, such as iPrevail and Happify. And it's easy to connect with all of these resources through my Cigna or by giving us a call. So let's talk a little bit more about our vendor, MD Live. So this particular vendor provides services for both medical care and also behavioral care, and they also are able to perform virtual wellness screenings. That's your preventive wellness screening that they're able to offer virtually. So on the medical side of things, if you're at home and you have a child, let's say, that has a fever or an earache or maybe pink eye, you can access virtual care through MD Live and connect with a board certified physician and either do a video consultation or talk to them on the phone. They can also prescribe medication if that's necessary. And then if you give them permission, they can coordinate care back with your PCP so that your PCP knows what's going on outside of your visits. In addition, you can make an appointment with one of MD Live's virtual behavioral providers, and there are several different behavioral areas listed here, such as addictions, depression, stress, postpartum depression. So you can make an appointment with a licensed therapist or a psychologist or psychiatrist from MD Live as well. And then again, you can do a virtual preventive wellness screening with MD Live. And really easy to connect with MD Live. Either through mycigna.com, you can connect, or you can just give them a call directly if you'd rather not do it video. Okay. So I wanted to touch a little bit on the transition of care process. So what is transition of care? So this is a situation where you may be able to receive services for certain medical conditions that you are currently under treatment for. So those could be medical or behavioral conditions. And what this will allow you to do is stay with your current provider who is not currently in the Cigna network for a defined period of time. And those services would be covered at in-network levels through your Cigna plan. Again, the care would be defined for a certain period of time, and you do have up to 30 days after the plan start date to apply for transition of care. We actually have a future town hall that will be dedicated to this subject, so we'll definitely go in some greater detail about this process. We have some folks ready to help you through this transition and answer questions that you have, talk through the process. So take a look at the conditions that are in the orange box on the screen here, and if you feel that you fall into any one of these conditions, certainly consider whether or not it would be appropriate to apply for transition of care. So a great example would be if you're in your third trimester of pregnancy, maybe you're due the first week of July, you probably don't want to switch doctors for just a week for the first week of your plan. So that's a situation where you could apply for transition of care, and we would be able to cover services with your Kaiser doctor. Okay. All right. Now I want to talk about where to go when you have questions. So this is going to be both right now, so before July 1st and after July 1st. So we have some resources set up for you currently and some that are coming soon. So on April 24th, we will be opening up a Cigna pre-enrollment line. Phone number is listed here, and you can keep your eye on the DU Healthcare Transition website for additional information on this line. But essentially, we have pre-enrollment health advocates that will be staffing this line, and they will be able to answer questions for you on your different plan options available through Cigna. So as you're going through open enrollment, they can talk through your different choices and what might be the best fit, for example. They can talk about the basics of health coverage, or questions that you have about that. They can help you find in-network doctors, specialists, pharmacies, hospitals, et cetera. And just answer really any questions that you have about your transition, about the different plans, or about the provider networks available to you. This is a great resource. And so this will be available starting April 4th and all the way to July 1st. And then once we get to July 1st, you'll be able to contact us at the number on the back of your ID card. In addition, right now, at any point, you can go onto Cigna.com. So Cigna.com is our public-facing website, and on Cigna.com, you can go and look for providers in the Local Plus network. You can search for pharmacies in network in your area, and you can refer to facilities that will be available to you under the plan. I touched on a few of those earlier, such as the hospitals available to you, but you can absolutely go on and search for facilities such as hospitals, urgent care centers, lab testing facilities, behavioral health facilities, et cetera. I am going to now show you a few screenshots of how you might search for a provider on Cigna.com. And then I will absolutely touch on that again during one of our future town halls, and I plan to do a demo of it as well. But just to get you all started, when you go to Cigna.com, and it's not My Cigna yet, but just Cigna.com, the first thing you'll click on is Find a Doctor, Dentist, or Facility. You will indicate that you are covered by an employer or school, so click that one. And then you can type in your address, city, or zip code. So maybe you want to put in your home zip code because you want to search for providers close to home. Some folks like to see providers close to work. You can put in any address that you would like to search for a particular provider. And then you have a couple choices from there. So you can either search for a doctor by type. So for example, you can go in and type in that you would like to search for PCs in your area, or maybe you want to find a gastroenterologist or a dermatologist. You can search for any type of doctor within the Cigna Local Plus network by clicking on that button. Or maybe you were on a Cigna plan a few years ago and you had this great doctor and you want to see if that doctor is still in network with Cigna. You can search by name as well. And then you can also search by location. Next step that you'll want to click on is continue as a guest. So because you don't have an active plan just yet, you won't log into anything, but you will just continue as a guest to search for what's available in the network. And then you're going to click on Local Plus as the network, as the plan that you're searching under here. After you click on Local Plus, you will then get a list of providers within your search criteria. So you will be able to see, for example, not just the name of the provider, but where they're located, their phone number, what areas of specialty they're in, the hospitals they're affiliated with, their years in practice. You can click to view quality ratings and patient reviews. And really, it just gives you a lot of great information in order to choose that provider. We know that this is an important decision that you're going to make, as most of you are going to be have to move on to a new provider under the Cigna network. So you have a lot of information at your fingertips here in order to partner with a new healthcare provider. And then on the right-hand side, you can see the green check mark to indicate that that provider is in network and accepting new patients. All right, so starting on July 1st, you will very simply just be able to turn over your Cigna ID card and call the number on the back of your ID card to access information, customer service, access our nurses 24/7, 365. So one of the great benefits of Cigna is that we are open 24/7, 365. So if you wake up in the middle of the night at 2 a.m. and you're concerned about a claim, or maybe you have an upcoming surgery and you can't get back to sleep and you want to give us a call to get information about where you should get that surgery performed, you can contact us at any time of the day or night. We also can bring on a representative to speak Spanish or an additional 200 languages via interpreter. And then, as I mentioned earlier, you can connect with one of our nurses 24/7 as well. So say you have a child that has some flu symptoms and you're not sure whether or not to take your child to the doctor yet, you can talk to one of our nurses. They'll get information on the symptoms you're experiencing and let you know where the right place of care is or what next steps that you should take. And then you'll have access to mycigna.com and our mobile app after July 1st. So again, we would love for you to get registered as soon as you possibly can on July 1st so that you have access to tools such as the directory of doctors that I mentioned, hospitals, facilities. You can price out procedures and different places of care based on your own plan design. You can review your coverage, manage and track your claims, find quality of care information. The list goes on and on. You have a wealth of resources available to you through Cigna. And then in addition to all of that, when you call that number on the back of your ID card, in addition to be able to connect with one of our advocates or customer service, you also have a dedicated health team. So we have set up a personal health team for you employees on the Cigna plan. And essentially what this allows you to do is connect with professionals trained as nurses, coaches, nutritionists, clinicians, counselors, and the list goes on and on. So you have access to this team of individuals 24/7, and it's really a single point of contact. So, if you have questions about a course of treatment that you're going through, if you just need to talk to a nurse about questions that you have, if you want to take a more active role in your health and talk to a coach, it's all that same place to connect, and you have a number of individuals standing ready to help you with your healthcare needs. All right, so what's next? There are definitely steps that you can take now before we get to July 1st. So, a lot of you are going to have questions during this transition period, and we definitely have some recommendations on steps that you can take as you transition from Kaiser over to Cigna. We'll get in some more detail on those recommendations for the transition on Thursday's town hall meeting, but for now, you can visit Cigna.com to start looking for providers. You can start shopping around for PCPs and specialists that you might want to go see after July 1st. You can view a list of in-network pharmacies. You'll be able to view the prescription drug list. I think that should be posted shortly on your page. And then, we recommend that you do things like request, your last fill with your Cigna provider or with your Kaiser provider to get a 60 to 90-day fill, just to give you enough time to go see a new Cigna provider and get your prescription refilled from Cigna. And then, of course, as you're thinking about these different things, as you're listening to the town hall meetings, take note of your questions, write them down. If you don't have a chance to ask something today, maybe you go home and talk about it with your family members and some more questions come up. So definitely start documenting those, plan on attending upcoming town hall meetings and open enrollment discussions, and ask questions as you have them, for sure. We're here to help you. In addition, as I mentioned earlier, that pre-enrollment line will open April 24th. And that is another great resource for you 24/7 to call and ask any questions you have about the plans or about the Cigna network or anything that's on your mind. Okay. And then that healthcare transition homepage that's been set up. That is a great resource where we are providing some additional information to DU to post out on the site. So that will probably be updated pretty regularly with additional information. So again, lots of resources at your fingertips, and I look really forward to talking with all of you as we move along to all these other town hall discussions. And I think with that, we're going to try to answer some questions now.
Hillary, this is Tiffany. Can you hear me?
Yes.
Okay. We do have a number of questions, and we are trying to answer as many of them as we can in the chat. But we do have some overall themes. And so, Jaron, I'd like to have you start out, if you don't mind. One of the largest questions that's coming in is asking for more clarification around the wellness program. Do employees that are working towards wellness points now, do they need to complete that? Are they able to stop acquiring those points? Will they lose the incentive for the lower premium on their medical plans, or is that being taken into account? And Jaron, if you are speaking, you're on mute. Okay, it looks like we may be having some technical difficulties, and Lloyd Moore is working on responding to those questions that those of you posted regarding the Well at DU program. Hillary, we are having a few questions around finding providers. How do we know who is accepting new patients? How can employees get help there? We're used to having a Kaiser model where Kaiser kind of directs you to that provider that would work best for you. So can you address that question?
Absolutely. That's a really great question. So we have a number of different resources available to you to find providers. So one of them that I talked about a few minutes ago is Cigna.com. So that's a really good place to start. If you hop onto Cigna.com and you go through those different steps that I told you about and click on Local Plus, you can then get a list of providers that are the best match, right? So based on your zip code, you can get a listing of PCPs, for example, and it'll return, a pretty large list. And then you can go in and research additional information about each of those providers. So you can see information about quality. You can look at patient reviews. That's really helpful. All of it's helpful in making a decision on a new provider because this is a big deal, and we get that. In addition, starting on the 24th, you can call our pre-enrollment line, and they are absolutely happy to help you find a new provider if you'd rather talk to somebody on the phone versus using Cigna.com. So I will spend some more time on future calls, of course, going through that Cigna.com tool, and I'll also show you how to look for a provider once you're able to register on myCigna.com after the plan year starts.
Great. And Hillary, can you also address the question that's come in several times about, is there a way to search for a PCP or a primary care physician who is supporting or affirming of LGBTQ plus individuals?
So I'm going to phone a friend on this one. Courtney, I don't know if you are available.
Yes, I'm here.
Thank you.
Sorry, I'm just coming back online. At this point, so I had responded to a couple of folks on that one. I do need to look into that further. At this time, there is not the ability to search for those providers through our online tools, but I need to just verify if our health advocates, if you call in, if they have insight into that information. So we will certainly circle back as soon as we have that information. Great question.
Awesome. Thank you.
Mm-hmm. All right. Hillary, Another question that has come up quite a bit is in regard to prescription drugs. So if we have drugs that are in the middle of a fill or of a prescription period, do they need to be, obviously the pharmacy has to be transferred over. Can we transfer a prescription from a Kaiser doctor to a Cigna pharmacy, or will a patient have to find a new provider and get a new script written from a Kaiser doctor?
Yeah, so what we're just doing, so a couple things in that regard, right? So that's part of the reason I mentioned getting as much of a fill as you can before your Kaiser plan ends at the end of June, right? So that you have plenty of time to get that. Also, get a copy of your prescription. So if you have a copy of the prescription, you could take it then to a Cigna network pharmacy to be filled, right? But eventually, yes, you're going to have to initiate a relationship with a new Cigna provider so that they can write you a new prescription for that. So that's why having as much medication as you can to get you through the transition is super important. And Courtney and Brandon, I don't know if you add that at all, but.
No, you covered it.
Great.
Okay, great. All right, Hillary, we have more for you. We have quite a number of questions as well about getting medical records transferred over. Is there a way to transfer these to a central kind of Cigna repository? Can we transfer, if we know the new primary care physician that we'd like to see, are we able to transfer those prior to July 1st, or does that need to wait until after July 1st?
So you can absolutely get the process started now. So that's one of the things that I will cover on Thursday's meeting, but I'll touch on it now as well. So absolutely start just to get your medical records transferred. However, you wouldn't send those medical records to Cigna. So this is a little bit of a difference between Kaiser and Cigna, right? So the doctor that you end up choosing as your CP or specialist, that is the one that you will need to officially transfer your medical records to. What you can do now is contact Kaiser and, for example, request your medical records in the form of like a CD, and that way you can provide that to your new Cigna provider once you have that appointment set after July 1st. But absolutely start that process. And I think I've heard in the past it can take 4 to 6 weeks potentially to get your medical records transferred. So certainly no hurt in contacting Kaiser now to do that.
Great. We also have a lot of questions surrounding pre-existing conditions. Can you respond to whether or not Cigna will exclude any pre-existing conditions?
No, we will not. We do not exclude any pre-existing conditions. We're here to help you with whatever your conditions are, right? With a lot of the resources we have available.
Along the same lines, we have a number of people asking the question of what might be excluded from the plan? Are there things that Kaiser was covering that Cigna will not cover? And I know that's a very large bucket of items. And Brandon, maybe this is a question that's better suited for you. Brandon, can you respond to any exclusions under the Cigna plan that would be covered under the Kaiser plan?
Yeah, absolutely. Thank you, Tiffany. So our goal in putting the plans together was to offer the richest possible benefits and provide the richer benefits that you have today. So for example, we're covering in vitro at an unlimited amount. Our goal was not to have any leaner benefits. So off the top of my head, I can't think of anything specifically. If we catch anything, we'll try to address it before your plan goes live July 1st. But we're anticipating that you're not going to see any issues in moving over to Cigna from a benefits perspective.
And I've been answering a lot of these questions in the chat, but I want to point out that in terms of the HMO plan and the high deductible plans that you have today, the Cigna plans have been designed specifically to mirror those plans. And when I say mirroring, what I mean by that is the deductibles remain the same. The out-of-pocket maximums remain the same. Co-insurance, co-pays all remain the same. So the intent of these plans is to feel as much like Kaiser as possible, the only change being the network and not the benefits that you all have access to. Michelle, I have a question for you. We have a number of individuals asking a very smart question of, can you guarantee that Cigna is not buying the business? How can you be sure as the consultant for DU that Cigna has provided a fair and responsible quote to the university?
Yes, I'd be happy to talk about that. As your health and welfare consulting personnel, both Tiffany and I did a very detailed proposal for the market. And one of the things that we did was ensure that the experience was being used, not any other factor. So how the plan was operating, what the risk was under the plan. And one of the ways to safeguard that is to ask internal financial questions, the guaranteeing of what trend factors were used for inflation, but also saying, make sure that you are pricing this exactly according to the experience and the risk involved in the plan. And in order to guarantee that, we need to make sure that you will put a no more than rate guarantee in the second year. And Cigna was able to do that. And therefore, they know that whatever the claims experience is under this arrangement, they are fully responsible for those claims. So it is not in their best interest, nor did our evaluation of their underwriting show any evidence of buying the business. It was based on experience, and in order to guarantee that, there is a second-year rate cap in place.
Okay, Jaron, I think we have you back. We have a few questions for you. The first one that hopefully will be easy to answer is, will this presentation be recorded? When will it be available to employees to review and share with their families, and where can they find that?
Perfect. Hopefully you all can hear me okay. And apologies for my technical difficulties. Yes, this presentation will be recorded and will be available on the website that we've stood up internally at DU, where we will have each of the town hall recordings there for folks to go back and review. In addition, we will be holding a Spanish translated town hall for this town hall, the introduction to Cigna, tomorrow. And then there are 4 additional town halls scheduled, and we will be providing, working to provide Spanish translation for those as well. I imagine these will be going to the website as soon as we, get that technical piece processed and placed on.
Okay, thank you, Jaron. And along the same lines, when will employees be able to see what the plan costs will be and the plan design options? When will they be able to visually see what I just told them, that the copays and everything will line up?
Perfect. So we're currently working through reviewing all the documents and materials right now. And so we understand how important this is to get into the hands of our community, so you can start making informed decisions or answering any of the questions you may have, or getting answers to the questions you may have. The plan is we're standing up the pre-enrollment hotline on April 24th. And so we are committed to getting these documents available by the 23rd. And if we can push for earlier, please believe that we will make that available, because we recognize how important it is to get that information out there.
Thank you, Jaron. One more question for you while your technical things are working there. Lloyd is diligently going through these questions, but we still have about 140 questions out there, so it may take him a while to get through. Can you speak to the wellness incentive going away? What does that mean for employees in terms of, do they still need to be working towards getting those points? Will they no longer have a free medical plan option?
Wonderful. Thank you so much, Tiffany.
Oh, thank you, Lloyd.
And thank you all for the questions. Beginning July 1, the Well at DU program will not be tied to the medical premiums. So what that means is that any points accumulated this benefit plan year will not have an impact on the premiums beginning July 1. Now, we are looking for ways maybe to reward those who have accumulated the necessary points. We're just not there yet. But any questions or concerns regarding the Well at DU program, by all means, feel free to email us. We will continue to have a wellness program. And as a matter of fact, we will enhance our wellness program, or programming, I should say. but beginning July 1, those premiums will not be tied to well@DU. Tiffany,
Okay, thank you, Lloyd.
the question there?
I believe that answers it. Yes, thank you. Hillary, can I have you circle back around to transition of care? We have a lot of questions that have come up here, and unfortunately, some of them may have come in before you went through that section, and some are looking for a little bit more clarification. If you could maybe pull up that slide again and just remind everyone of what they need to do for transition of care, and then speak to any conditions that are not contained within the condition list that you had there. Are those just examples? Is that the full and comprehensive list of what conditions would be considered?
So let me work on pulling out the deck real quick. And I can tell you that this isn't an exhaustive list of the conditions that might qualify. So what we'll be providing to you is a document that really outlines this process. And hold on, let me know if you can see this, Tiffany.
We can, thank you.
Okay, great. So yes, these are examples of what might qualify for transition of care, and we will be providing a document that gives some additional information, and we will also have one-on-one support available for this, right? So if you are under if you are under acute care for a condition right now, you can always give us a call and see if it's a condition that might qualify. So like if you have your own personal example and you find out this is a process that would apply to you, absolutely reach out to us. You can send us a separate message through your HR team. You can call the line 1-5. So a lot of resources to you to answer those questions. And Tiffany, remind me, what was the other part of the question?
Hillary, I think you've answered that question for us, that this is not an exhaustive list of conditions. So thank you for that.
Definitely not. And
Hillary, sorry, do you mind if I just build off that real quick and just make a couple
Please
more?
do. Mm-hmm.
Yeah.
Yep.
Just so everybody in the line knows, we also have someone assigned specifically for your transition of care form. So Lola Crowshore, she's going to handle the forms when they're sent in to us. They'll be sent in directly to her, and the process will be handled by her. She understands the importance of making that as easy as possible for you, and she's personally going to handle that situation. So we understand this is something that you want to be, that you want taken care of quickly, and Layla is going to handle that personally for you.
Okay, thank you, Brandon. Another question, Brandon, I'm going to pick on you since you're off of mute right now. How is billing handled? If I visit a facility and they bill me, do I have to submit this to Cigna, or does the bill get sent to Cigna directly?
Well,
how do providers bill?
Yeah, so you're going to be utilizing in-network physicians and facilities. When you go to see an in-network provider, most likely depending on what the service would be, if it's a copay plan, they would collect your copayment up front. Odds are, though, if you're using, say, an HSA plan, they would run their claim through Cigna. Cigna would confirm what the actual cost would be. They would remove that amount from your cost and send you a bill that you would then pay. So if you're utilizing in-network providers, which you would be doing, they would run the claim through Cigna and then send you a bill after we've let them know how much they could charge.
Okay, thank you, Brandon. Hillary, I have another question for you. If we have a developmentally disabled adult child currently on the plan with Kaiser, how would you handle that? How can someone get care set up for that individual who's over age 26?
Over age 26. So Courtney, can you help, and Brandon, can you help with that question in terms of the age?
Courtney, you may be on mute.
Sorry, just got it double muted.
Thank you.
Yeah, keep me honest, Brandon, but it's my understanding that in the instance of a developmentally disabled adult child, that they are allowed to be on the plan, per the governmental regulations. Brandon, are you aware? We may have to circle on that one too.
Yeah. So there are folks with disabilities or things like that can remain on the plan. We would have to follow up on this specific situation, but I don't imagine there'll be an issue. We're happy to follow up on this after the call.
Yeah, this is Michelle. I'll confirm that per federal law that a disabled individual may stay on the plan for as long as they are disabled. And from time to time, an employee may be asked for continued proof of that through the physician, but that's the extent of it. And of course, if there is an individual situation that you would like to discuss, that's certainly one of the things that you can reach out to either one of the Cigna representatives, the health advocate line, or one of us at Gallagher. But rest assured, if you have an overaged dependent that is disabled, they will be covered by the plan ongoing.
Thank you, Michelle. Okay, Brandon, I'm going to call on you again. We have a number of individuals asking about how international travel is covered.
So international travel is covered for emergency services. If you're going out of the country and you need to seek care, those aren't contracted physicians because they're international, they're in different health systems. So they may ask you to pay up front, or they may work with Cigna for your billing. Odds are a lot of them would ask you to pay up front. If you do pay up front for emergency services, just save your receipts and submit them to Cigna as soon as you can for reimbursement.
Okay, thank you, Brandon. Hillary, can you speak to us a little bit about preventive care? So what are some of the general preventive care items that are covered? And then I'll have a follow-up, but I'll follow up once you answer that.
So I'll give several examples of preventive care. So you can go see a PCP, for example, for your annual physical. Your OBGYN, you could see your OBGYN for a well visit, for example, pediatrician for a well child exam, your flu shot, other vaccinations, childhood vaccinations that are important to get. I mean, those are some examples of, particular appointments and vaccines. And then of course, like your mammograms, colonoscopy. I'm trying to think of a more exhaustive list, but we actually have very exhaustive available that we can provide to DU to post of everything that falls under that preventive category and would be covered there. So did you want to add something, Tiffany?
So, yes, yeah. Hillary. So let's pretend that I am 25. I think you can tell that's a pretend scenario there. So I'm 25 and I have family history of breast cancer or a genetic test that confirmed that. Would Cigna cover my mammogram as preventive care, or would I have to wait until I'm in the correct age bracket?
That's a really good question. I actually ran up against this, so I was able to get a mammogram prior to the sort of suggested age to get a mammogram because I have family history as well. My mother has had reoccurring breast cancer several times, so that mammogram, that preventive mammogram, was covered. So that's the issue, right? Is I'm going in for a preventive mammogram. I'm getting that done prior to an issue showing up. It makes it covered as a preventive service with no cost. So
okay, great. Yeah. Thank you so much.
I'm
not sure who on the Cigna team to ask this question to, so I'm going to open it up and let any of you jump right in. Can you talk to us about COVID-19 testing, treatment, and vaccinations? How will that be covered under the Cigna plan?
Well, so your vaccinations are going to be covered when you're able to get in and go and get vaccinated and get an appointment. For COVID testing, and Hillary and Courtney, you may need to correct me on this because I'm going to butcher the name, but your actual COVID test, if you think you've been exposed to COVID-19 and you need to go get a test, that's covered. Hillary and Courtney, you might need to step in on the other tests.
Yeah, well, the only thing I want to, if you might want to step in on the actual treatment, but the additional resource available to you that I wanted to mention in terms of testing, a lot of those testing sites, they might be run by the county, so that would be covered anyway. But outside of that, you have an additional resource available to you through mycigna.com to get an at-home test too. So lots of different options there, and the testing itself is covered if you have an exposure symptoms. Do you want to add to that?
I think you've covered it. Yeah, I think the
Okay.
only piece there was the ongoing care. Was that correct, Tiffany? Yeah, the initial care, should someone need to be hospitalized from COVID-19, is certainly something that is being covered as we're talking in-network providers. And then, it's up to kind of how the doctors see the care and what the need is long-term. That's going to be a patient-doctor situation at that point. But we want to make sure you're at an in-network facility, in-network docs. That's going to help you to receive that highest Cigna discount.
Okay, thank you. Another question that is coming up quite a bit, and I don't mind answering this one to give everyone a quick break, is when is open enrollment? So open enrollment will be held from May 10th to May 28th. And there is a question, is that July open enrollment date only if you're currently not on Kaiser? So this open enrollment period is active, which means everyone needs to go through open enrollment. So whether you're on Kaiser, whether you're not on a DU health plan today, everyone will need to participate in that. And more information will be coming out shortly to help walk you through what that process will look like. Okay, Hillary, more network questions. A lot of people, it looks like, while you were talking, were logging into Cigna.com and looking for the correct network. So can you please confirm that we should be looking at Local Plus? Is that the most appropriate terminology, or is there something else that they should be looking at?
Plus, for sure. So when you get into Cigna.com and it has you put in your code and everything, and you will choose to continue as a guest, and then the next screen after that will show you all of the plan options, right? And in that list, you just need to find the Local Plus link and click on that, and that will get you through, show you providers available within the Local Plus network. So yes, that's what you need to be searching for.
Okay. We also have a number of questions regarding the hospital systems that are going to be included under Local Plus. So I don't expect you to be able to name these off the top of your head, although I do think Michelle could probably name them off the top of her head if she'd like to, or Brandon could. But can you give us a good highlight of which hospital systems are covered? Most commonly coming up are St. Joseph's, National Jewish, Children's. Can you respond to that, please?
Yeah, so I mean, I come up with a few off the top of my head. I'll count on the other panelists here to kind of fill in the gaps for me a little bit, but it's an extensive list, and there are over 60 hospital systems, of course, within the state of Colorado. So that's the SCL Health one. So off the top of my head, Health One is like Skyridge, right? Centura Health has several hospitals, like Parker Adventist. That's an example of a Centura hospital. National Jewish Health, of course, as we mentioned, and then feel free to interject.
Yeah, I'll jump in. So UC Health is one as well.
Yep.
Children's Hospital, that's a big one that folks are going to want to know about. Centura, National Jewish, and then you mentioned SCL. So for those that aren't aware, that would be St. Joe's, and multiple others, but specific to your question on St. Joe's, and then Health One, which is Skyridge, Rose, those. So those are our majors. That should cover the bulk of the major metro area, south, north, what have you. So
I don't know if you said Boulder Community Hospital, but that's in there as well. And Good Samaritan is also an SLC or SCL, excuse me, health system as well. And Rose, Adventist system is as well.
And for anyone that's not familiar, Anschutz. Oh, thank you. Jaron did provide a very comprehensive list in the chat for anyone that's able to see that. And then if you're not aware, Anschutz, that's the other commonly asked question, and that is part of UC Health, so that is covered as well.
And you can hop onto Cigna.com at any time to do a more extensive search for the hospitals and network as well.
Okay. Brandon, a question for you. Can you speak to alternative medicine that might be covered under the plan? And specifically, we're asking for chiropractors here, but if you have any information on acupuncture, anything else along those lines.
Yep, so we would have mirrored those benefits. I apologize. I don't know that off the top of my head what those look like, but we would have mirrored what you had today. So I'm happy to follow up and see, but if you have acupuncture today and chiropractic coverage today with Kaiser, we mirrored those benefits.
Okay, thank you. There's another question around prescriptions. And so Hillary, this might be a good question for you. Will employees be forced to use the mail order service for prescriptions?
Definitely not. So you have the option for sure. So you can either fill your prescription at a retail pharmacy or you can fill it with delivery. Home delivery is just, it's a lot more convenient option, right? So, when I've been on a maintenance medication in the past, I am terrible about, I forget to refill my prescription until like the day of. So having those reminders from home delivery and having that mailed to me is more convenient for me, but you certainly have that choice.
All right, thank you. More questions for you, Hillary. Can you speak to fertility benefits that are being covered? And you may not have the specifics. If you don't, Brandon does, or I do, Michelle does, we can speak to that as well. But specifically, not just fertility, but how is fertility covered for LGBTQ plus community? And then also, can we speak about gender transition benefits?
Brandon, I may need your help on that one.
Yep. So gender transition benefits are covered based off where the service is it is covered, and it's based off where the service is being provided. So whether it's in a hospital or what type of facility, it'd be covered under that facility copay or co-insurance amount after your deductible. So depending on what plan you enroll in and what facility you would get that procedure done at, it would be covered. Infertility coverage, a couple enhancements that we've made. In vitro is covered at an unlimited amount, which I know we talked about earlier. Also, your medications tied to infertility coverage are going to be under your pharmacy plan instead of covered at 50%, which is a big difference because when you're looking at your pharmacy benefit, a lot of times there are copays instead of a 50% coinsurance, or if it's on your HSA plan, be your deductible and then copays. So a lot richer there. So we think once you get the infertility benefits, you take a look at them, you'll be really happy with the move.
And I'd like to point out as well, currently under the Kaiser plan, you only have access to IUI, and you have 3 sessions of IUI that you're able to have access to in your lifetime, so not per plan year. So under Cigna, you have access to IUI, IVF, GIFT, and ZIFT. And as Brandon said, there are no lifetime limits on those. Okay, so hopefully that's helpful. Michelle, I have a question for you. Are there neutral parties, not Kaiser and not Cigna, available for guidance for individual concerns related to how best to proceed with procedures or surgeries already approved or planned through Kaiser?
Yes, Gallagher is an independent party. We can, we're not medical doctors, but we can help with the process and who to send you to and get you in touch with medical professionals that can assist you in an unbiased approach.
And Michelle, can you maybe tie in the health advocate solution that's coming to that response as well?
Yes, under your program, Hillary spoke earlier in pretty good detail about the One Guide, which is a personal team that can assist you. But you also will have access to a team of personnel called health advocates that do have medical professionals, whether that be doctors, nurses, psychologists, psychiatrists, to help you with the very situation you were just speaking of. And that is an advocate team that is available 24/7, 365 days a year. And that is in differentiation to the One Guide, where it will help you find a doctor, answer some common questions, go through your billings. Health Advocate can do some of that, but they can also assist you in finding scheduling appointments and finding pathways for some of these more private situations, more complicated services or surgeries, anything of that nature. So that's a resource that I think that you will be very pleased with and can do a lot of that very private, very intricate medical conversations, avenues of assistance, and really kind of white glove servicing on an individual basis.
Okay, thank you, Michelle. Brandon or Hillary, do home IV services exist? So someone that is receiving maybe chemotherapy or something that's an infusion, will they have to start going into a doctor's office, or can they continue receiving care at home?
So,
Brandon, I'll ask you to add to this maybe, but I mean, that's definitely an option. You can talk to our, that's where you can call into our health advocates to really help you, that personal health team, to help you figure out what the right course of care is. Do you want to add to that at all, Brandon?
no, I was just going to say that, and if there's a specific need that you want us to follow up on, or you need assistance with, please let us know. We'd be happy to follow up after this call.
Okay, thank you. All right, Cigna team, surgery approval. So for surgery that was already planned by Kaiser, approved, it's scheduled for after July 1st. I know that we've talked about this a little bit in terms of transition of care, but can you speak to this one more time? Will that KP approval stand, or will Cigna need to provide some sort of pre-approval for the surgery as well?
So Brandon and Courtney, feel free to interject, but I think this is definitely a situation where you can reach out to us about the transition care process, and we're happy to walk through this with you and get you to apply for this and see if this would be a good fit. I mean, not knowing your specific situation, I can't really answer the question at this point, but absolutely something you should reach out to us about regarding transition of. Brandon, do you want to add, or Courtney?
No, I'll add to it. That's exactly what transition of care is for. Literally, that's why we have the process. So you would complete. We'll send you the information. Your provider will give you some information to fill in. You'd send it to us. We'd get it filed, and we would get that approved, so you can have your procedure done with your Kaiser doctor.
And I believe also, isn't there that personal touch that you had said earlier with Layla that will assist people through that process?
Yep, and just so everyone knows, Layla's information is going to be on the form that we send you. So Layla Crochar is her name, and she's going to personally handle these situations. She's well versed in the process. She knows what she's doing, and we'll make sure that this is handled quickly for you.
And Brandon, you anticipated my next question. You kind of addressed it by saying quickly. Can you give us any sense of how long either that pre-approval for a surgery may take or transition of care approval? And I know some of that depends on how quickly you can get doctors to respond to some of the questions you asked, but do you have kind of a general timeline that you can give people?
Yeah, I mean, it depends on the urgency of the situation. So if there's something that's urgent, so for example, if you have a procedure that's happening right away, right after your plan's effective, we're going to get it done quicker. The longest it would take is 10 days, but we understand 10 days is too long for a lot of these procedures. So it really depends. Most of the time it's 5 days, something like that. But if it's urgent, we can get it done quicker. If it's not urgent, it'd take roughly 5 to 7 days for approval.
Okay, thank you. Brandon, I'm going to ask you this question as well. Will out-of-network costs be higher, e.g. if we have a child that lives outside of the network? So can you circle back and address those dependent children that are, out of state at school or with another parent, and they're taking advantage of the away from home care network? Are the costs any different than if they were at home with their parent under the Local Plus network?
No, they're not. So your benefits would be the exact same. What you actually pay from your benefit summary, our away from home care network is an in-network solution for employees or members that are located outside the state. So if you have a dependent that's going to school outside of the state and their Local Plus isn't available, they would utilize the same benefits that you are.
Okay, thank you. So people are definitely listening to what we are all saying, and so there are some follow-up questions coming in. And Brandon, I'm not sure if you're the person to ask, or Jaron or Michelle. I'm going to open this up to all three of you. If the out-of-pocket costs are the same under Cigna as they are under Kaiser, the out-of-pockets, the co-pays, everything like that is the same, where are all the savings that we're saying are coming? Where are they coming from?
I'd be happy to take that if everyone's comfortable with it. So when we're talking about just the overall cost of the plan and care, part of the process of looking at partnering with Cigna was we were provided information on what you would need and the services that I guess you've seen in the past. We took that information and we essentially analyzed it and said, what would the cost of this be if we transitioned all of this over to our Cigna providers? From that, we were able to determine that we were able to save DU money as on an aggregate basis with the same plan designs, which lowers your overall premium cost. I think that's what the question is. If it has to do with plan designs, I'm also able to answer that as well.
Yep, I think you answered it.
Okay.
Yeah, this is Michelle. I would concur. It has to do with the cost arrangements, the kind of unit costs that Cigna is paying providers versus the overall cost it takes Kaiser to run their medical clinics and pay their providers. So it really is in the absolute per service or per unit cost of care.
Okay, thank you. Hillary, how and when will members receive the new Cigna ID cards?
So typically those ID cards arrive, I want to say a couple weeks before your plan is live. So it'll be sometime in mid to late June. So you'll definitely have those in your hand before July 1st. But in addition, one of the really cool things about My Cigna app and the My Cigna website are that you can log on at any time and pull up your ID cards. So if you have the app downloaded on July 1st, you happen to lose your ID card, or you just have it with you on a particular day, you can pull it up at any time there. You can email it to somebody, your provider's office, directly from the app. So definitely don't worry if that gets misplaced, and you will have it in your hands before July 1st. The physical copy.
Thank you. Michelle, I have a couple of questions for you that relate to Kaiser, and so I'm not sure if you'll be able to answer all of them, but I think you're probably the best suited on the call that has a chance of being able to answer this. So number one,
I will try.
When is the last day that an employee enrolled in the Kaiser plan can see their Kaiser doctor?
That would be June 30th. Up till midnight of June 30th, the contract with Kaiser is live. So if you have a doctor appointment on June 30th, you're good to go. Effective 7/1, you would, unless you're in a transition of care situation, you would want to be accessing the Cigna doctors.
Okay, part two of Kaiser, and I'm not sure if you will be able to answer this, but online records. Will employees lose access to the Kaiser online system on June 30th as well, or can they continue to access the Kaiser system?
We can check with Kaiser to be precise, but my thought would be if you are not eligible in the Kaiser system, that date would probably be the same. We can ask them if they could leave that record file open for a period of time. Kaiser has been very gracious and said that they will assist us in transition of records or information during this transition period of time. But once you cease to be eligible in their records, then having access to your personal records through the Kaiser system may be blocked. So we'd have to ask them for special permission to extend that record access date.
Okay, thank you. And then a similar question in terms of medical records. If employees do not ask for their medical records to be transferred by July 1st, do they miss their opportunity, or will they continue to be able to ask for medical records in the future?
That's a great question. There is no limit of time for you to ask for your medical records to be transitioned. So you could ask for those medical records to be transitioned after July 1, and the Kaiser physician should be willing to do that. But they'll usually do it electronically or perhaps via mail from physician to physician.
Okay, thank you. Hillary or Brandon, Kaiser was committed to offering free birth control whether or not the Affordable Care Act was in place. Does Cigna have the same commitment to offering free birth control?
Brandon, can you speak to what's on the plan specifically?
Yeah, Tiffany, I'd have to follow up on that specifically and just check on our formulary and see how it's covered. I apologize. I just don't know that off the top of my head, but I'm happy to follow up on that for you.
Okay, and I can tell you to the person who asked that question, there absolutely is quite a number of no cost birth control options available on the plan. And once the formularies are released, once those get posted to the website, we can help you determine which of those birth control, not only brands, but types are covered at no cost. So it is outlined within the drug formulary. You will see it with a special denotation next to it, but we'll certainly help you figure that out. And it's not just necessarily one type of pill, it's a myriad of birth control pills that are available, IUDs, et cetera. So we can definitely walk through that with you. Okay, a question came up. I think we're hitting some of these questions very quickly, and so everyone may not be able to keep up with us here. Are Rose Hospital and St. Joseph in network? And the answer to that is yes, they are in network. Let's see. Okay, Brandon, another question for you that you've kind of answered, but we have a follow-up question to it. 16-year-old son is on the wait list with Kaiser for his COVID vaccine. Will he still be eligible even if he doesn't get it by the end of June?
Yeah, absolutely.
And can he still get that at a Kaiser location if they are the ones who call up his name?
We'll be able to.
Yeah. Do you want me to take? Do you want me to take that? Yeah. COVID vaccinations are not linked to your relationship with the provider. So if Kaiser is a vaccination provider, they are able to disperse it. They are able to disperse vaccinations to anyone, regardless of whether they're a Kaiser member or not. So same way with Centura or any of the Health One. Anybody that is given vaccines from the government must provide them to anyone, regardless of their provider or insurance relationship. So if you have a vaccination appointment, regardless of where it is, but Kaiser is certainly a good example, you may keep your appointment there regardless of the date.
Okay, thank you, Michelle. I can answer this question. Will we be limited to specific plans, or will we be able to select any of the several plans, including HMO and PPO? So right now with Kaiser, you have an HMO plan, an HDHP plan, a high deductible plan, and a POS plan. With the move to Cigna, the POS plan is no longer being offered because the need for it is basically being addressed in each of the other plans. It's providing for those non-Kaiser doctors. So going forward, you will have access to, we would call it a PPO plan, but it's extremely similar to that HMO plan that you have today and the high deductible plan. So you'll have your choice of those plans. Okay. Brandon, this was semi-answered for international travel, but we're being asked for intranational, for domestic travel as well. I frequently visit my family in rural areas. I check Cigna.com and there are no in-network hospitals there. What happens if I receive emergency care from a hospital out of network while traveling within the country?
Yeah, emergency care is always covered in network. So if there's something going on and you have to go see a provider and it's life-threatening or it's an emergency, we cover that as in network.
Okay, thank you. Brandon, also for you, we're going to circle back to COVID. I don't think any of us are surprised to see that there are so many questions around this topic. So COVID tests are only covered when the individual believes to have been exposed or when the individual is ill. Can you clarify what you meant when you responded to how the COVID test would be covered?
Yeah, if you've been exposed to COVID or you believe you've been exposed to COVID, the test is covered. If you know, you just want to go to get a COVID test and you haven't been exposed, it wouldn't be covered. But if you've been around somebody that's had COVID, or you know, you think you need to go get a COVID test because you'd be at risk for being positive with COVID, it would be covered.
And if you have symptoms and you don't know for sure that you've been in contact.
Exactly that. Yeah, absolutely.
Okay. So is it fair if I say the exclusion to when a COVID test would not be covered is if, for example, DU is requiring that the COVID test be covered, but you have no symptoms and you have not been exposed?
If I wanted to just go get a COVID test every day personally, just because I wanted to do that, that would be an exclusion. But if there's a reason that you feel you've been exposed to COVID, you have symptoms or anything like that, it would be covered.
Okay. And I may have used a terrible example, but the point that I was trying to get out there is if DU is asking you to get that test, there are other methods that would be paid for at the moment. But if you're seeking a test on your own, those are the situations in which Cigna would pay for that test. Hillary, circling back to the question we asked regarding mammograms being covered as preventive care. Can you respond? I'm not sure if you have the answer to this, but would an MRI also be covered under that genetic predisposition when the doctor is requiring it, or would it only be mammograms that would be covered as preventive care?
Well, mammogram is a procedure. Preventive mammogram specifically falls under that category, right? So I can't think off the top of my head, and I have to look at the extensive preventive list, right? But MRI is not a preventive procedure, right? That I'm thinking off the top of my head. So, you know, maybe if you've gotten an injury and you need the doctor wants you to get an MRI, that's where you'll give us a call or hop onto my Cigna or the app, and you can look what your cost might be for an MRI at a free facility or a hospital, for example, and you compare us that way. Courtney, you want to add that at all?
Yeah, that's going to be, it's going to be seen more diagnostic when you're needing an MRI.
Exactly.
So it's really important to use the tools and resources, either calling the health advocates to help direct to a low cost, high quality MRI location, whether it's facility, hospital, what have you, that we want to really make sure that you're being a good consumer of your dollar and getting you to the right place of care. But typically we don't see MRI as preventive. Absolutely willing to look at anybody's specific medical situation though and address appropriately.
Yep. Okay. Excuse me while I'm trying to sort through some of these questions still. A few of them I think have been answered, but they're coming back up. So I'd like us to address them again because they're coming back up for multiple individuals. So Michelle, can you answer this question? Deductibles and out-of-pocket maximums. If I have already met a portion of my deductible or the full amount with Kaiser, do I have to start over on July 1st with Cigna, or do I get credit for what I've already spent this year?
You do not have to start over. As I said earlier, Kaiser is going to assist us. They're going to provide us with that data and information on deductibles or out-of-pocket expenses by individuals that have been covered. Now, the only thing I caution about that is there's a delay in Cigna getting that information, there's a delay in Kaiser getting that information in an electronic file feed and getting it over to Cigna. So the other way, you as an individual, in the meantime, if that data hasn't arrived at Cigna, you can take a copy of one of your explanation of benefits that shows how much of your deductible or out-of-pocket expenses you satisfied and provide that to Cigna, and you will be credited. So you do not have to resatisfy your deductible as of July 1.
Okay, thank you. And Jaron, can I call on you or Lloyd to answer the question again about when will premiums for the new plans be made available? That is clearly at the forefront of employees' minds right now. So when will they be able to see what the plans will cost them?
Perfect. I'll take that. So the pre-enrollment hotline will be set up on April 24th. And that's the hotline to be able to reach out with your questions prior to the enrollment period. We have to have the information by that date. The plan is to have it, the targeted date, April 23rd, to get that information in the community's hands. We're working hard to try and get that sooner because we recognize how important that is to have that information right now. But right now we're targeting the 23rd of April.
Jaron, are you able to give any sense of, will plan costs for employees look the same? So per paycheck cost will look the same? Will there be an increase for employees this year? Will there be a decrease? Is it too soon to know?
I'll have Lloyd answer that one because I know it's a better articulate response around that one.
And I do apologize. I was responding to another email. Could you pose the question again, please?
Yes, Lloyd. Are you able to give employees at this point in time any sense of what their per paycheck cost for the plans will look like? So will it be the same as it is today, more expensive, less expensive? There's some anxiety around this, so I'm not sure if it's too soon for you to be able to tell employees what that might look like, or if you're able to put some minds at ease here.
Well, I would say that the university is working diligently to not increase premiums effective July 1. Actually, Jaron, I'll let you speak to that. Perhaps you've seen the final numbers and can answer that question.
I'd say it's too early to share that right now.
Okay.
Yeah.
All right. Well, thank you for that. At least we know that we're hoping not to increase rates for anyone. So that's great news. Courtney, I don't know if you can answer this, but I feel like I haven't picked on you quite enough here. So there have been a lot of questions about the dental plan, and we've been responding that the dental plan is not changing, that it will remain with Delta Dental. However, in the case of medically necessary dental procedures or orthodontia procedures, so things that result from a medical accident, jaw issues, migraines, things along those lines, does Cigna provide any type of coverage for dental procedures there?
Yes, we do. And you phoned the wrong friend, though. I don't know the details around this. I'm sorry, Brandon. I mean, I know that there's a level of coverage there. And sorry to pick on you.
No problem. No problem. So yeah, anything tied to a medical condition that has to do with dental would be covered in the medical plan. So an example would be if somebody's in an accident or there's something that happens, an injury, and dental services, you need to have dental services because of a medical issue, it would be tied to the medical plan under your place of service.
Yeah, and I'll just accentuate that it needs to be tied to a medical diagnosis, a medical condition. So if it's an accident that warrants a medical, a surgery, or it's in conjunction with a medical service, it really does. TMJ is one of the ones that comes up the most, which is a jawbone and joint condition. If that is in relation to the teeth and their alignment, it's not seen as medical. If in fact they have to do work on resetting the jaw, which is considered a medical diagnosis, then it would be covered by the medical plan. So it really comes back to, is it tied to a medical condition or medical diagnosis?
Okay. One more follow-up question for you, Hillary, in regards to the mail order pharmacy. I know you stated for us that members do not have to use mail order, but is there a discount if they do? And actually, this may be a Brandon question. I know with the Kaiser plan, we can get a 3-month supply of mail order drugs for 2 copays, 2 months worth of copays. Is that still going to be the case with Cigna?
Yeah, so for our plan, I believe we've got our 3-month fill. So we do have retail and home delivery for 90 days for a 2-month or 90-day supply for twice the copay. So if your copay is $15, it would be $30 for a 90-day supply through our mail order program.
All right, so it can save money to go that route.
Yeah, absolutely. So I just need to let everyone know that we have gone over time. So we're going to try to get as many questions as we can answered in the next 5 minutes, and then we're going to wrap up. However, additional questions we will continue to answer, and these will be posted. And Jaron has a comment, I think I see.
Yeah, so just to go back to the premium question, and sorry, we weren't able to share the specific savings, but as we shared in the initial slides, that there can be anywhere from a 22 to 33% savings or decrease in the premiums for those that don't have to utilize the wellness incentive. And then for those who don't already utilize that wellness incentive, it was a 13% decrease in premium. So overall, the expectation with the plans are the premiums will decrease for the community.
Okay, thank you very much, Sharon. Let's circle back to some questions around PCPs. More and more of these are coming up. So for those of you who don't speak our lingo, I apologize. PCP is a primary care physician. Today with Kaiser, we do have to select a primary care physician, and often we need to see that individual and get a referral to see a specialist, or sometimes even a COVID test, or different items here. Hillary, I think you look eager to answer this question. Can you respond to PCP specialist referrals? How does that work with Cigna?
Yeah, for sure. So that is not a requirement with the Cigna plans. So you will be able to, if you want, set up a relationship with a PCP, but it is certainly not going to be a requirement under this plan. In addition, you can see a specialist without seeing your PCP first. There is not a referral required in order to see a specialist. So we are essentially removing that step as part of the plan. So you'll have a lot more flexibility to be able to access whatever provider you'd like without the requirement of a PCP.
Okay, and then very specifically, so if I were to select a PCP, a primary care physician, and then I did not like that physician once I actually went and had an appointment, can I change them? How difficult is it? Do I have to get approval? How does that work with Cigna?
You can change it anytime. It's super easy. So I didn't mention this earlier, but I personally am on Local Plus. After all I have as a Cigna employee, I chose the same network. So I have changed PPs before, and it's a super easy process. So I chose one, and then I decided after a few months, after a couple visits, that I didn't want to go to that one anymore. So I just hopped on my Cigna, found a new provider, and really super easy when you look up that provider to just click on make this my PCP. And then you will get, I believe, a new card in the mail that will indicate your PCP on the card. But again, it's not a requirement by any means. So you switch as often as you.
Okay. Jaron, this is a question for you or potentially Lloyd again in regards to premiums. The premium holiday mentioned at the beginning of the presentation that will occur in November. Number one, we've had the question, will this be every November or is it a one-time occurrence? And number two, is it a free premium month for anyone who's covered by the employee's coverage, or is it just the employee-only coverage?
Lloyd, are you able to speak to this one?
Sure, I'll speak to this. The premium holiday is for the medical premium. It's for the employee portion of the premium. So any premium that the employee is paying for medical will not be deducted from the November paycheck.
Okay, and Lloyd, is this a 1 year only, or is the expectation that this will be every year? Do we know that yet?
Right now, this is a one-time premium holiday. Should that change, we'll definitely inform everyone. But right now, it's just for the month of November only.
Okay, and tying to that, Lloyd, we have a couple of people asking a very similar question here. DU said they will pass the cost savings on to DU employees. Can you tell us how that will be passed on, giving specific examples? And I think we've hit on some of those here and there, but are you able to kind of tie that up quickly for us?
Yeah, I'm going to defer to Jaren or to the folks who handle the financials to address that question.
So this one, and we actually have some really great slides around that information, and it gets a little bit complex. So we will promise to get that information out to the group following this, so that it's clear and we're not rushing that piece, how the cost savings are shared. Before there was a question that was raised, and I think this is more specific to Kaiser, and I'm not sure we're able to answer this, but if we can seek to get the answer. But this is around, if you have an existing payment plan with Kaiser that's, let's say 18 months, will that be able to continue with Kaiser, or will individual be forced to accelerate or make those payments sooner? And I'm wondering if this is something that, if we don't know, if Michelle or Tiffany, we can outreach to Kaiser and get that answer, because folks have questions about it.
Yeah, Jaren, I think we'll have to outreach to Kaiser on that one. Is it fair for me to say that some of these questions, especially the Kaiser specific questions, I know there's an FAQ document that's being posted to the website. Would that be a good place that we can update with some of this information as we get it? Okay, so we'll ensure that those questions get answered and updated to that site. Okay, just quickly here, I think this is an important question that's going to kind of nag at some people. Hillary or Brandon, on the drug formulary that was provided, it looks like that has been posted to the DU website and some individuals are looking at that formulary. So number one, is that a comprehensive document? If there is a drug that is not listed on that formulary, should an employee assume that that drug is not covered at all, or should they be reaching out to Cigna for confirmation?
I think they should be reaching out to Cigna for confirmation.
Mm-hmm.
Sometimes there are medications that aren't included on that list, and we're happy to look at that for you. They can call the pre-enrollment line, confirm it, or there's a way to look it up on Cigna.com as well. So if there are any issues with not being able to find medications, let us know, and we're happy to assist with that.
Okay. Yeah. Thank you. Yes.
Sorry,
go ahead, Hillary.
I didn't mean to cut you off.
No, I was only going to add just one extra. As I mentioned earlier in the presentation, definitely plan on attending the additional town hall meetings, because we will definitely touch on some specifics around prescriptions, transferring those over, what the process is for that, and really go into a lot of detail. We'll talk about transition of care during one of the other calls. So definitely take a look at the meeting schedule and plan on attending those meetings and your questions. So thanks, Tiffany.
Sure. Yeah, and I was just going to point out also that typically those drug formularies, we see the most commonly prescribed drugs, but there are thousands out there and very difficult to fit into one document. So yes, definitely don't assume that it's not covered. And then Hillary, the prescriptions on there are sorted by, bear with me while I try to explain this, $1 sign, $2 sign, $3 signs. Can you elaborate on what that means to the employee? Does that mean it's tier one if it's $1 sign, or just an indication of less expensive, most expensive?
I think, Brandon, correct me if I'm wrong, with that's just kind of indicating like the less expensive to the more expensive spectrum of drugs available.
Yeah, so I'd have to double check the list, but it should be tier one would be the $1 sign, tier two would be the $2 sign, and tier three would be the $3 sign. And when I say your tier, your copay, so your generic copay, we call it a preferred copay, and then a non-preferred copay. So ideally, you want to be under the $1 sign if your medication is there, or your doctor can prescribe that drug.
Okay, great. Okay, one other question that keeps coming up in different ways. Right now, a lot of our employees are really used to the Kaiser-based model where you can go to one location and get all of your services. Is Cigna aware of any providers that you work with or that you contract with that are able to do that as well? So I can go see a primary care physician, get my lab work done, maybe get an x-ray if I need it. Are you aware of anyone like that currently in your network? Or do we need to refer employees to reach out to Cigna One Guide, the pre-enrollment line?
I could certainly take that. I actually seek care in a very similar setup. I live in Castle Rock, and most of my providers happen to be, they're all Centura providers at Castle Rock Adventist Hospital. So my PCP has an office in the adjoining office building at the Castle Rock Adventist. I get my mammogram at Castle Rock Adventist. I see my OBGYN, which is also a Centura doctor in that same facility. So I think there are scenarios where you can get pretty close to that model when utilizing care within some of those larger healthcare systems. So.
Yeah.
Okay.
And Tiffany, real fast to piggyback off that, if you're looking at providers that are accepting new patients, you can always call our customer service line to confirm, who are the Cigna preferred providers or who are the care designated providers. Because a lot of times we'll designate the providers that, for lack of a better way of saying it, do the best job from that perspective and can have your lab work done when you go and get your preventive care and things like that. So just piggybacking off what Hillary was saying.
Okay. And Hillary mentioned Centura.
I would just second that. Not only does Centura have many of those, but the UC Health System also has medical offices and clinic sites that do lab work and x-rays and things internally. I think the biggest change will be most will not have prescription drugs on site. But you do have multifaceted facilities. And I think Brandon's idea of going through their One Guide and Health Advocate that can help you find those, if you want that, if that's a particular value to you, go and get that one-on-one coaching and let them help you find the doctors and perhaps multifaceted clinics that will work best for the value you're looking for.
All right, wonderful. And I just want to point out, and then we are out of time and we'll wrap up here, but there's a couple of other questions that have come in, and since Hillary brought up Centura, I'm going to go ahead and address this question. It has been asked if there's a religiously affiliated provider, will there still be limitations on services offered? And we'll pick on birth control as an example. And the answer to that is yes. Cigna cannot control what those religiously affiliated groups will and will not offer. But the good news is that you have several other opportunities to seek care outside of that. And so think Centura, think SCL Health. Those are both affiliated hospital systems. But again, One Guide can walk you through all of that, and they can help you figure out where else to go. Okay, I thought I saw a slide come up for just a quick second. We would like to thank everyone so much for joining us today. We know this is a big change, a lot of questions. We know we have not gotten through all of the questions. It looks like we got about 150 answered and 170 left to go. So we will keep at it. We will get this information out to you. We will get it updated in the FAQ section. We have more town halls coming. And one I want to really point out is transition of care. This keeps coming up over and over in the questions, and it does look like we have several people asking for specific sessions just on this for those with chronic issues. So please join us for that transition of care town hall. These will be recorded. They will be posted. If there's more topics that you'd like to see handled, let us know. Cigna is open to hosting those as well for you. And then keep in mind, we will have multiple open enrollment meetings as well, where we can continue to dig into the pricing, co-pays, exactly what's covered also. So once again, thank you all for joining us, and have a great evening.